Thank you very much. I think quite a lot of information regarding what our colleagues, what the patients think about the situation, the treatments, what could be improved, what are the problems, what are the obstacles. I would like, if you don't mind, start our discussion with the important problem regarding prioritizing the aims of our treatment. We have noticed that both physicians and patients consider improving symptoms, quality of life, exercise capacity seem to be important, as important or even much more important than prolonging life. Could you comment on that? Our guidelines are based mainly on morbidity mortality trials, whereas we see that the needs from the patient's perspective may be also a bit of difference.
Yeah, it's interesting, isn't it? And I think what was important for me is fatigue is so much there on the list of what's really troubling patients. And yet we don't really talk about that very much. We don't really have great solutions for that. But I think let's not overdo this quality of life discussion, Eva, because people wanted to live longer. That was their priority, but they also want to live longer with reasonable quality of life. And I think that's what we all want. So I think both surveys for me had a lot of face credibility. This is what we hear day in, day out from our colleagues and our patients. It's nice to have it quantified and to make us think more about what does success look like? What are we trying to achieve for our patients, for our services? And these surveys are really helpful.
Michel, would you like to comment on that as well?
No, well, I agree with what Martin just said. The only point I would like to make is that probably the quality of life at large is really more important for patients than what we reflect in our guidelines. And I think this is probably a plea to include more patients in the drafting of future guidelines on heart failure, because it's a chronic disease with exacerbations. And probably we should in the future pay more attention to symptom relief and quality of life improvement in our guidelines, although it's difficult to do that in clinical trials because it's a bit complex to assess, to be honest.
Mm-hmm. Having Martin Cowie here, I could not ask the question about the potential involvement of telemedicine and all this, applications, all technologies which are around. Do you really believe that they may help, that maybe elderly people will not be afraid of them? How to find the best approach for patients?
Well, as you know, I'm a digital enthusiast, but I think the survey is right. Most people want that human contact. Mm-hmm. And I think once they have the human contact, they don't mind that being supported by remote consultations, by being signposted to apps or the internet. But the core of it all is human-human interaction, personalizing things, and ensuring a range of tools. So I think digital is part of the answer, but it's not the only part. It's just something we should use. And, the other thing to say is that it's not so much age, it's about what somebody feels comfortable with. And I think we need to support people to use the tools, both physicians, nurses, and patients that fit what they're used to. Make sure we signpost to resources and think about the whole range of things that might work. But at the end of the day, it's human to human comes up at top of the list.
Yeah, fully agree, yeah. Michel, I would like to also ask you about the barriers in implementing heart failure treatment. You discussed several of them. Which of them do you think are most critical and which could be easily changed?
Well, I think that patient education is critical because we probably do not do our best in order to really let people be aware of the objectives of the treatments, alarm signals, and so on. Secondly, there are some organizational issues in many countries, as I mentioned, and I think this is actionable because a proper organization when a heart failure patient leaves the hospital of checking that he or she has appointments with his or her GP, his or her cardiologist are very simple measures, which I think could improve the situation and avoid this inertia that we see after an hospitalization. And finally, and I think the survey amongst the patients highlight that, polypill, I think, is an issue because we saw that on average they are taking nearly 10 pills a day. So if we can reduce the number of pills, I'm pretty sure that it would improve the compliance to medications.
Having here our colleague from China, Professor Yui Zhang, could you let us know Chinese perspective, how things could be better for heart failure patients?
Yeah, I also have some feelings to join in this survey, and they let me to learn more the voice from the patients and also the voice from the cardiologist. And I think for the patients, I also to change some mind that in the modern times, the patients have more needs for the treatment. They not only for the prolong of life, but also to have the normal life, have the normal activity, and to live independently and have a very high life quality. So this really to think more about in the future we can to design some add some endpoint for this, and also for the patients, that there is some difficulty to treat the patients for the cardiologist. I think the first is the comorbidity, and the number one is the CKD, and also for there is some side effect. And for me, I think the number one is the blood pressure. So we need to pay more attention to have a very suitable and very optimal for every patient. And the last, I learned something from the survey is I have some think about the telemedicine in the future, but the patients maybe need more ways to talk face-to-face with the doctors, and they hope to get more to connection with the doctor. So I think maybe in the future we can make some stratification for the patients and make some not very severe symptoms or severe status maybe get more benefit from the telemedicine.
Yes, indeed. I think although there are many things to be discussed, we are unfortunately running out of the time. I wonder whether there are any other comments from Martin, Michel, or Julie for this part. If no, I would like to thank, first of all, our colleagues, our experts who provided great lectures for very engaging discussion. I think we have tackled quite a lot of problems with heart failure. We put the stage for the next webinars where we will go into details how we can improve treatment of heart failure patients and how we can go on globally with this problem. So I would like to thank you very much to all of you. I would like also thank very much our audience and welcome to the next webinars in this series. Thanks a lot.
Thank you.